health rights activists in Kenya have welcomed the repealing of the Mexico City policy by the Biden administration. The policy, which is widely known as the Global Gag rule, withholds all the U.S. global health assistance from international organizations that provide or even offer information on abortion. Joining us now to talk about this is Kenyan-based journalist Nduta Waweru. Nduta, good to have you with us tonight. So what does this policy actually mean as far as the work that activists are doing on the ground and the fact that now it has been repealed?
When the policy was put in place, it created a lot of problems because among the many things that happened is that many women from low-income areas were not able to access healthcare services, especially in terms of reproductive health, as well as in terms of abortion and abortion services, maternal health care, and even contraception services. So when it was put in place, it meant a lot of balancing acts for women from low-level and low-income areas, because they had to decide between, am I going to provide food for my family or am I going to get contraception services? So it became a little bit tricky for them. They lost so many things. And the thing as well is that the Global Gag rule interfered with programming, including other general health services. For example, things to do with HIV and AIDS, things to do with other maternal health care, immunization, and even in terms of malaria and other kinds of diseases in the country, because a lot of the organizations that offered these services offered a wide range of them. But since they offered reproductive healthcare services, especially and including, that is, abortion services, it became quite difficult for them to get the funding, because the Americans had decided that since they are not going to, they're pro-life, they are going to not fund any organization that offers such services. So whether you're offering the contraception and abortion services on its own, or you're offering other health services, including abortion and contraception services, then you would not get funding.
Now, the Trump administration reinstated the gag rule when they came into power. What was the rationale? I mean, what was their reasoning and their thinking about its reinstatement?
I'm not exactly sure what their rationale in America is, but locally, I think it got a little bit of support because a high percentage of Kenyans are not pro-abortion. So even the constitution in the country says that abortion is only permissible in certain situations. So by trying to stop the funding of these services, they were hoping to stop these particular services being offered. But as is the case in the country, there are quite a number of cases of unsafe abortion cases. Young girls and even women in the reproductive age tended to go to backdoor services, to alleys and everything, and they would end up with so many complications that would get them back they will get them to hospitals for extra treatment options and such kinds of additional services that would have been prevented if they were able to access contraceptive services, if they were able to access information about their reproductive health, and if they were able to access abortion services as well. So in this particular case, when those things were not there, then we've seen a lot of consequences, increased unsafe abortion cases, we've seen increased teenage pregnancies, we've seen even increased poverty levels, because getting a child also indicates that there is more mouths to feed, and this means reducing the extent to which income can be spread.
Yeah. And now this was further, I see, expanded to other global health programs, including HIV and AIDS, the PEPFAR programs, the malaria programs, child maternity care programs. I mean, literally, it went into the entire healthcare system? I mean, how many jobs were lost? Did organizations have to lay off people?
Yeah, quite a number of organizations were forced to lay off people because the funding also came in terms of giving this guy the staff income. It also came in terms of expanding programs. So a number of people had to stop some programs, outreach programs, and with 2020 and COVID-19, also that reduced the number of programs that could be activated within communities. It also meant staff had to go home because if a program is not there anymore, why are you here? Secondly, we can't afford you as an organization, then probably you just need to go home. And for that, it has caused so many issues. When you talk about the different kinds of programs that have been affected, malaria, for example, we don't know the numbers yet, but there's the indications that the cases might rise. Also, cases about HIV, and we've already seen issues with HIV because already as at last year, the number of young girls, especially who have been affected, is almost double the number of young boys. So there is a lot of issues surrounding the kinds of programming and the effect of the global gag rule on them.
Yeah. Now, of course, the Biden administration has come in and lifted the gag rule. It doesn't immediately mean this money will be made available and will roll out immediately. I mean, what will it take to reverse the kind of damage that was created by the Trump administration in the last 4 years?
Importantly, and first of all, is that Kenyans will have to wait a little bit longer. That's why I think the careful bit of the story was there, because as you've said, it's not going to be immediate. There's going to be a lot of work that needs to be done. But there've also been calls locally for organizations and even other policymakers to consider increasing domestic funding to reproductive health services. One of the important things that had come up, Kenya was elevated to a middle income country. So it meant that some of the donor-funded programs had to end, but they're ending in a moderate way. Not all of it at the same time, but they will end in moderate ways. And this means that even as a country, we need to make sure that we have provided alternatives to what was the donor funding to be able to manage and keep up with the programs on reproductive health, with the programs on HIV, with the programs on tuberculosis and stuff like that. When the ICPD was held in Nairobi in 2019, President Kenyatta was among the people who said, yes, we're going to increase funding. So I'm hoping he's going to do something about it, especially now that we are really not sure if the global gag rule will be completely gotten rid of, or it will be an executive order depending with the president that is coming in. If, for example, the next president of the US comes in and says he's bringing back the global gag rule, what will developing countries do? So there is a call for local communities, for countries across the continent to actually put in place measures and to put in place funding to ensure that the reproductive health services do not get affected, even with the international fluctuations of funding and stuff like that.
Yeah. Looking at the Kenyan situation, the limitations brought on also, for example, by the COVID-19 pandemic, to what degree is that kind of target attainable, where the country will be able to set aside such a fund?
It will depend, because the advantage with us right now is that we have county governments, and county governments are looking for ways to make sure that they have put in place systems to fund such programs and to get in touch with what is happening on the ground, so that they can put in place other measures to ensure that the impact of COVID-19 is not completely felt on issues reproductive health. But personally, it is going to be a long process, because we are getting into an election year, and a lot of times such content, such situations are put aside. so that they can focus on who's coming into office next time. And then from there, we can pick up on other issues. But I think it is time, and policymakers, non-governmental organizations, and even people on the ground should all stand up and actually get the county governments and even the national governments to actually put in place all these measures. Besides reproductive health, they should also consider other important issues, and especially youth empowerment, because a lot of COVID-19 has affected a lot of youth in the country in different ways, economically, psychologically, and even just generally. So those are some of the main things that county governments and national governments should consider.
Nduta, thank you very much for joining us tonight. Nduta Waweru, Kenyan-based journalist there, talking to us about, of course, the developments around the gag policy that was put in place by the Trump administration.